Place the patient's hand in the mitten. Ensure proper finger placement and finger separators if applicable. Secure the wrist closure using lace-up, buckle, or hook and loop closure, depending upon style. When using the lace-up styles, tuck the laces into the mitten to help prevent the patient from releasing the laces with their mouth. Do not over-tighten. 2 fingers should fit between the device and the patient to ensure circulation is not compromised. If more protection is desired, the attachment strap may be used. To apply the attachment strap, feed the end of the strap through the loop on the mitten. Feed the end of the strap through the C-wave buckle and adjust the strap so that the buckle is positioned near the loop. Secure the strap to the bed. To secure the strap, find a place underneath the bed that moves with the patient. Wrap the strap around the anchor 2 times. Then pull the strap through by forming a single loop to create a quick release tie. Secure excess strap out of the patient's reach.